This framework, largely derived from the work of James Childress and others, posits that public health agents carry the burden of proof. The default position in a free society is liberty. If you want to restrict that liberty, you must prove your case. You must satisfy 5 distinct conditions: effectiveness, proportionality, necessity, least infringement, and public justification. Think of these as a series of locked gates. You cannot proceed to implement a policy until you have unlocked each one. If a policy fails even one of these conditions, it is ethically suspect. We are going to walk through them one by one, examining the nuances that make this framework so difficult and so important to apply in the real world. The first gate is effectiveness. This seems obvious, but it is violated constantly. The question is simple. Will the infringement actually achieve the public health goal? We need evidence, not just intuition or hope. If you are going to infringe on a person's rights, say by searching their bags or mandating a test, that intervention must actually reduce the risk. If it doesn't, you are restricting liberty for nothing. This brings us to the concept of security theater, measures that look like they're doing something but actually provide no tangible benefit. Think of temperature checks at airports that miss 90% of infections. Ethically, if an intervention is ineffective, any infringement on liberty, no matter how small, is unjustifiable. You cannot burden citizens merely to appear like you are doing something. Now, effectiveness is tricky when we are dealing with a new threat, like a novel virus. Sometimes we don't have the data yet. In these cases, we often invoke the precautionary principle. It is better to be safe than sorry. We might implement a measure based on plausible theory before we have concrete proof. However, this creates a secondary duty, the duty to reevaluate. If you implement a policy based on a guess, you must collect data immediately. If the data later shows it isn't working, you must stop. It is unethical to continue a restriction simply because it's already in place. Effectiveness is not a one-time check. It is a continuous requirement. A policy that was ethical in January might be unethical by June if the data changes. The second gate is proportionality. This asks, is the juice worth the squeeze? Even if a measure is effective, the moral or social cost might be too high. A total military lockdown of a city would be very effective at stopping the seasonal flu, but the economic devastation, the mental health crisis, and the violation of rights would be vastly disproportionate to the threat of the flu. However, that same lockdown might be proportional for Ebola or a plague with a 50% mortality rate. Proportionality forces us to weigh disparate things: economic loss, mental anguish, and civil liberty against life years saved. It is a grim calculus, but it is necessary to prevent overreach. The third gate is necessity. This is a high bar. It asks, is this the only way to achieve the goal? Have we tried voluntary measures first? If we can achieve herd immunity through education, advertising, and incentives, then we are ethically obligated to try those before we move to mandates. A mandate is an admission that persuasion has failed. You cannot jump straight to coercion just because it is faster or easier. Necessity demands that we treat liberty as a priority. If you can save the village without burning it down, you must do so. Coercion is only ethical when it is necessary to prevent a significant harm that cannot be prevented by less intrusive means. The fourth gate is least infringement. This is often confused with necessity, but it is more about the design of the policy. Once we have decided we must act, we must choose the specific implementation that encroaches the least on individual rights. For example, let's say we need to track a disease outbreak. That is necessary, but do we need to publish the names and addresses of the infected in the newspaper, or can we publish just the zip codes? If zip codes are sufficient to protect the public, then releasing names is an unethical infringement on privacy. We are obligated to cut with a scalpel, not a machete. We must constantly ask, can we tweak this policy to preserve a little more privacy, a little more freedom, while still doing the job? Let's look at another example. Isolation. If someone is infected, they need to be isolated. But how? Can they isolate at home? Or must they be dragged to a government facility? Home isolation is the least infringing option. If they prove they cannot be trusted to stay home, maybe then we move to electronic monitoring. Only if that fails do we move to forced detention. We move up the ladder of infringement only as needed. This principle demands that we respect the dignity of the person, even while we are restricting them. We never use more force than is required to neutralize the threat. The final gate is public justification. This is where modern policy often fails. Public health officials have a moral duty to explain their reasoning to the very people whose liberties are being restricted. We must be transparent about the data, the risks, and the reasons why we are overriding their autonomy. This isn't just about PR or politics, it's about respect for moral agency. Citizens are not subjects to be ruled, they are partners in the social contract. If you treat the public like children who don't need to understand the rules, you lose their trust. You must show your work. You must say, we are doing X because of Y data, and we will stop when Z happens. When public justification is neglected, the vacuum is filled with conspiracy theories. Without clear explanation, a scientifically sound policy can feel like arbitrary tyranny. This leads to non-compliance, which defeats the effectiveness of the policy. Furthermore, justification implies reciprocity. If the state restricts you, say by closing your business, the state owes you support. You cannot ask the public to sacrifice for the common good without the common good supporting them in return. Public justification is the bridge of trust that allows the whole system to function. Without it, the police power becomes brittle and eventually breaks. To wrap up Lesson 2, these 5 conditions, effectiveness, proportionality, necessity, least infringement, and public justification, are your compass. They do not always give easy answers. Reasonable people can disagree on whether a measure is truly necessary or proportional, but they force us to have the right conversation. They prevent us from sliding into authoritarianism by accident. In the next lesson, we will take this framework and test it against a real, messy, controversial case study, the New York City A1C registry. We will see what happens when the goal is noble, but the methods are intrusive.